This week, the Biden administration had an opportunity to stop price gouging from big pharma on one particular kind of drug that many cancer patients need. They chose not to do that. Instead, they allowed this particular drug called Xtandi to continue at its current price, which can be, for some people, $180,000 a year, this necessary cancer medication. By the way, sorry, that's what it costs here in the United States. Depending on what country you live in, it can cost 3 to 6 times less. So it's certainly possible to make it available for much less money. We're just not gonna do that. So first of all, some info about this drug. The patent on Xtandi is currently held by pharma giant Astellas, which in turn shares the US market with Pfizer. It's been proven to be effective in treating prostate cancer and is on the World Health Organization's list of essential medicines, according to some great work by The Lever. The drug's ingredients, very importantly, were developed at UCLA, a public university with grants from the US's Army and National Institutes of Health. So a case can be made that this medication would have never been produced if it wasn't for taxpayer money. We helped to produce this medication that now can cost $180,000 per year. So what could the Biden administration have done that would potentially cut the cost of this? Well, in late 2021, prostate cancer patients Robert Sachs, Claire Love, and Eric Sawyer petitioned the US Department of Health and Human Services to exercise its quote, march-in rights against Xtandi. So under the Bayh-Dole Act, the federal government can reclaim and redistribute patents for inventions created with public funding, enabling generic competitors to produce cheaper versions when quote, action is necessary to alleviate health or safety needs, or when an invention's benefits are not being made, quote, available to the public on reasonable terms. So it definitely is not being made available on reasonable terms if it can cost $180,000, the price of a house in some parts of the country, and that's just for a 1-year supply. And action is clearly necessary to alleviate health or safety needs because people are suffering and dying from these forms of cancer on a regular basis. And so, by the way, even if you have Medicaid, you might have to pay $10,000 a year to pay for this, far less than other people, perhaps, but still an amazingly high amount of money for people who don't have it to spare. And it isn't like they haven't already made a lot of money off of this drug. The patent holders of Xtandi have earned over $20 billion from it. And so the Biden administration was receiving pressure from numerous members of Congress and medicine affordability advocacy groups. But despite that, the NIH declared earlier this week that it, quote, does not believe that the use of march-in authority would be an effective means of lowering the price of the drug. First of all, I'm not a doctor, I'm not a scientist, I'm not a lawyer, I'm not many things. But it definitely would be an effective way to cut the price of this. If you make the patent available for generic competitors, I have a feeling they're gonna be able to produce something that's less expensive than $180,000 per year. That is not a logical or reasonable explanation for them stepping in to stop this, particularly considering the amount of lobbying that's come in to try to stop march-in rights from being exercised, and in particular from people like Xavier Becerra's previous commentary, even in recent years, about how the government needs to exercise this power more often. But now all of a sudden, once he's partly in charge of it, suddenly not interested in doing it.
Okay, so now let me explain to you how almost everybody in power in this country systematically lies to you. Xavier Becerra is a giant liar. Joe Biden's an enormous liar. But I think the corporate media, mainstream media that you're used to, are the biggest liars of all. So, but let me prove my case. And of course the drug companies are liars. The only people who would be stupid enough to believe that drug companies are not liars are reporters in this country. Okay, so they say we need incentive for research and development to make these amazing drugs. Well, that sounds pretty compelling. The drugs are amazing, they do save a lot of lives. I want them to have an incentive for that. And by the way, I'm a capitalist, so I believe in that incentive structure. Well, first of all, $20 billion wasn't enough incentive? I'll take it. You know what? And I'll cap it at 20. I'll cap my profits at 20 billion, okay? And now you say, Cenk, that's unfair. That's a drug company, that's their whole infrastructure is built around that. And you couldn't do that. No, I could. I could do the same exact thing. Oh, that's an outrageous thing, is it? It was developed 100% at UCLA. The government didn't develop some of it, it developed all of it. They didn't need $1 for research and development. The government then handed it over to the companies, and the companies said, thanks for the $20 billion gift, suckers. And then they just sold it. I could set up a company today, I'm a businessman, I could set up a company today to sell that drug like that in a week. And you know how much it might cost me? It might cost me 20 million. and then I would take the profit of 20 billion and put it in my goddamn pocket. This is an absolute robbery, okay? So the drug companies might help around the edges, but in this case, again, 100% developed by the United States government and taxpayers. Hey, taxpayers, you know what happens when a company develops something and hands it to another company? They get most of the profits. Did you get any of the profits? No, we got none of the profits. And corporate media is like, I can't tell. What is that? What happened? The government paid for 100% of the research and development, and all of these lies that we've printed 1,000 times in every article about how they need to be incentivized for research and development, they were lies? Well, golly gee, what am I, a reporter? Okay, Xavier Becerra, when he's out of power, when he's not in the administration, we have to make sure we lift this rule so you could have drugs at reasonable prices. Now he is in power, he can do something about it. Canada, for example, it costs 1/5 of the price. We pay 5 times what Canada does. For some of you, Canada is like one step away from you. What's magical about Canada? Their government is not corrupt. They don't take bribes 24/7 from drug makers. You know how much bribes the drug companies gave? I'm sorry, mainstream media reporters, let me be polite. Campaign contributions, $250 million. $250 million. Do you think the drug companies, are you as stupid as a mainstream media reporter that says, oh no, I think that they gave it for the general welfare? And I think Nancy Pelosi and Joe Biden and all the people who took the money, oh, they just took it just because they happen to agree that drug prices should be 5 times higher here than they are in Canada. They think that's a good policy. It's a bribe. Everybody on the planet knows it's a bribe except mainstream media reporters are like, no, that's outrageous. These scandalous young Turks calling it a bribe. That's just $250 million just free from the drug companies. They don't care about these regulations. They're wonderful human people who are just trying to do research and development, okay? Becerra, you're a liar. You never, ever meant it. This is what, and then what, so he says, oh, I demand lower drug prices. What happens next? Mainstream media does articles about Becerra wants lower drug prices. Becerra says lower drug prices. He's in charge. Okay, great, you have an amazing opportunity right here. You can do it right now. I'm just messing with you. No, you're gonna pay 5 times what Canadians pay. And if you don't get, you're a Medicare patient, you can't afford $10,000 a year, you're gonna die. You're gonna die so that they can have bigger profits. By the way, one of these companies, the main company, is a Japanese company. They made $1 billion off of this drug just in 2021 in profits. No, the Japanese company has to get paid $1 billion. You die for the Japanese company. Mainstream media, did any of you call them out? Any of them? Joe Biden, what does mainstream media tell you? Oh, the price of insulin is capped. He capped one drug out of thousands and tens of thousands of drugs. He capped one drug, insulin. Joe Biden is lower drug prices. Joe Biden, American hero, Joe Biden, lower prices. Insulin, $5 to $35. Insulin, oh, Joe Biden, lower drug prices. No, Joe Biden is 1,000% in favor of higher drug prices. Now get a load of this. Right-wingers, why isn't your right-wing media flipping out against Joe Biden like we are? We're on the left and we're tearing Biden's face off on this because he can get you killed with this. Why hasn't Tucker Carlson or Fox News or any of them said anything about it? Because they're also corporate media. It's good cop, bad cop. Whenever it's culture wars, oh yeah, oh, can you believe the goddamn M&Ms? Trans people, oh, you get really mad. Oh, he's doing a robbery? Shh. Fox News loves it when you are robbed. CNN, New York Times, they all love it when you are robbed, and they would not tell you the truth under penalty of law.
Yeah, I mean, look, I want to be fair. The Biden administration was a part of lowering insulin prices, and that was an initiative of theirs. So, like that is something that should be noted, but it's undercut by something like this. And the problem is that they felt insulin would be more of a political benefit to them because it's so widely used. And this is a lot more under the radar. And the problem with it is that Biden is actually just not really a progressive. He's a cipher, as we like to say on the Majority Report. He goes with where the party currently is. And that means you're not really tethered to any leftist, progressive, democratic, socialist ideology that would allow you to be consistent on these kinds of things, including when it comes to cancer drugs. Because I'm gonna be a little personal here, But Biden has run on cancer and has spoken about it quite a bit because of his horrible, unimaginable experience with his son, Beau, who passed away from cancer. And so you would think that when he speaks about cancer during the State of the Union, that these kinds of decisions made within the administration, he would be a bit more consistent on it. But the problem is that he is not somebody who has a real peg to any leftist organization or specific ideology on this front. And in an insane society, this is what would happen. If the government helps you develop a drug, by the way, this applies for the COVID vaccine as well, then the government has the capacity to set price limits. That's it. That's it. Game over. We're not doing this, but we're giving you money to develop a drug. You take that money, then you make a ton off of it by price gouging. That should not be allowed. In fact, with the COVID vaccine, that should have been a part, that should be owned by the government. And like we gave billions and billions of dollars with no strings attached to Moderna and Pfizer. They have the technology, they developed it with government money. Now they're with the end of the emergency authorization, another crazy thing that Biden is doing for seemingly no reason except to appeal to right wingers. The Moderna and Pfizer are gonna gouge on the COVID vaccine, and people that don't have insurance, hey, you're out of luck and you're gonna have to pay out of pocket in order to not get COVID, which we've seen has effects on people, particularly if you have a pre-existing condition. So this lack of consistency stretches throughout the Biden administration. And frankly, we just have such, the private healthcare system, big pharma has such a chokehold on our country that standing up to them, like our government can't even seem to stand up to them. When in any sane society, again, something like the COVID vaccine would have been, the intellectual property would have been waived. It would have been free to everybody, including underdeveloped nations, which is what frankly, Western governments were responsible for, allowing those countries to get sick because, hey, pharma in the West has to get rich.
Okay, last quick things here. First of all, my personal opinion, they get zero credit for insulin because it's a smokescreen. They regulated one drug to distract you from the fact that they are not regulating all other drugs. And they say,
yeah,
oh no,
that
don't
helps
worry.
Millions of people.
No, don't worry though. We're also gonna do 9 more drugs in 2026. Wow, no, Emma, no credit, zero. It's a smokescreen.
That helps millions of people.
Oh, whatever, so that they could screw over 300 million people on every other drug, and idiot media can go, insulin, the only drug that matters, he has lowered drug prices.
He's impersonating me right
there.
Look,
say that to people who are on insulin. I mean, come on.
Like, yeah, you should have free insulin. Like you should have all of those other drugs under Medicare for all. Joe Biden is lying to you and you will die from something else because he is using that as a smokescreen to make sure that his goddamn donors get rich off of you dying. So no credit for one stupid drug. It's a perfectly great drug. Don't get me wrong, even though I'm angry. Okay.
Incredibly widely used.
Oh, Emma, are you kidding me?
No, I'm
you
not
don't
kidding.
know that that's a smokescreen?
No, I know that it genuinely actually affects. There's millions of people.
It's like saying, hey, I'm gonna bomb a building, but I took one person out. Hey, you're welcome. Hey, everybody else in the building, you're dead. I should get big credit for the one guy I walked out of the building. What do you mean?
I would like to say that I am also stupid.
My opinion is not about just like fixing everything with one fell swoop. I think that what the government can do to help people, they should get credit for it. It makes your argument stronger when you give them credit and then hammer them elsewhere.
I'm not giving them credit for 1 out of 20,000, 200,000 drugs. It's meant to deceive you. I am not gonna fall for a trap to deceive our audience. Okay, we disagree on it, God bless. If you guys are in the Emma and John camp and you think one drug, Joe Biden, one drug, oh my God, it's amazing.
That's a direct
Joe
quote.
Biden is awesome, okay? I'm straw manning, I'm sorry. I know you didn't say that, okay? Okay, so last thing.
Go Joe!
Okay, NIH, sorry, I lost the earpiece, everything's gone. NIH puts out a statement that says, hey, the law is we should do this if it's available at a reasonable. That's what at a reasonable price. If it's not available at a reasonable price, you should do this action that they refuse to do. The NIH put a statement saying, What do you mean? We're not doing anything because it's available. That's not what the law says. Available at a reasonable price. They purposely left out at a reasonable price and said, what? It's available. If you have $189,000, it's available.
Yachts are available.
Okay, this is how we lose faith in institutions. NIH has great scientists. I trust them on the science. We're not lunatic right-wingers who are like, oh, scientists and doctors are evil. No, they're great people at NIH. But the very top levels are completely corrupted. They are definitely gonna work for drug companies after they leave. That's why they put out an absurd statement like this, is available at $189,000. Did you hear about insulin?
Yeah, I mean,
no
credit. Was a financial burden for 15% of Americans, 10 to 15% of Americans. That's been helped by that. That doesn't mean that he's good on healthcare. I just listed off a bunch of reasons why he's inconsistent and bad. But this is a good thing. That was a good thing that happened.
Sorry, Emma, he can't hear you, so I have to translate. She told you to go F yourself.
Okay,
just wanted to clarify that.
Fair enough, I don't get offended.
Thanks for watching The Young Turks, really appreciate it. Another way to show support is through YouTube memberships. You'll get to interact with us more. There's live chat emojis, badges. You've got emojis of me, Anna, John, JR. So those are super fun. But you also get playback of our exclusive member-only shows and specials right after they air. So all of that, all you gotta do is click that join button right underneath the video. Thank you.